I'm Disha. Today we are just going to discuss arthritis. Arthritis, it is a disorder that affects the joints. The symptoms, generally the joint pain and stiffness, and others. The symptoms may include the redness, warmth, and swelling, and decrease the range of the motions. The affected joints and some types of the arthritis and other joints are also affected and can be the gradual and sudden. So arthritis, it is joint pain and stiffness that is in the joints, and there are the various over 100 types of the arthritis. The most common types of the arthritis: degenerative joint disorders and decrease the range of the motion and affected joints. Arthritis, here the rheumatoid arthritis, it is a common term that is used for the joint pain, stiffness, redness, swelling, decrease the range of the motions, etc. Osteoarthritis usually occur with the age, affect the fingers, knees and hips, and rheumatoid arthritis, immune disorder, and also affect the hands and the feet. Other types of the include gouts and the lupus, fibromyalgia, and septic arthritis. So these are septic arthritis. It is related to the antiseptic. It is against the antiseptic is used. Osteoarthritis more than the 3.8 people who rheumatoid arthritis affect around 0.24% of the people, and gout affect about 1 to 2% of the Western populations of the some points in their lives. In the Australia and other cities, there the classification, there are the several disorders which joint pain is primary and considered as the main features. Generally, when the person has arthritis, it may mean that have these disease, and this includes hemoarthritis, osteoarthritis, rheumatoid arthritis, and the joint pain is also has the symptoms. And the arthritis, the secondary, the mean psoriasis, rheumatoid arthritis, Easter's Dendrite syndromes, and hepatitis, Lyme disease. So, if we are going to see in the pain, which can vary in the several and the common symptoms in the various types of the arthritis, other symptoms include swelling, stiffness, redness around, itching around the joints. Arthritic disorders like the lupus and rheumatoid arthritis can affect the other organs in the body, leading to the various symptoms. Symptoms may include inability to use the hand and walk, and stiffness in one or the more joints, rash or itchiness, malaria and the fatigue, weight loss. Okay, the most common advanced, it is a significant secondary and change in occur in the osteoarthritis. Here the difficulty in the around the muscle weakness and loss in the flexibility, decrease in the arthritis fitness, disability. And arthritis is the most common type of the disability in the United States, and more than 20 individuals in the arthritis have the several eliminations in the functions in the daily basis. Absences and the frequent visit in the physician are the most in the 50% of the old earnings, and each arthritis results in the 1 million. Okay, what are the risk factors? What are the diagnosis? The diagnosis is made in the clinical examinations from the appropriate health professionals, and may be supported by other tests such as the radiology, such as the blood test. Depending on the type of the suspected arthritis, all the arthritis potentially they feature the pain and pair the pattern and may differ. There the pain pattern, the osteoarthritis, the location, rheumatoid arthritis is generally across the morning and associated with the stiffness lasting in the 30 minutes. Blood test, X-ray, and have the high osteoarthritis sedimentation rate, and that is called SR rate. So, that's all.